My name is Daniel Lowe. I'm an orthopedic surgeon who specializes in total joint replacements. I'm originally from Lorain, Ohio. I did my undergraduate training at OrthoUnited. I went on to do my medical training at OrthoUnited as well. I did my residency here in Canton, Ohio at Altman Hospital. I chose OrthoUnited because I trained here and I saw the level of care they provided for patients. The physicians don't treat patients as just another surgery or just another patient. They treat everyone like they do their family. So I wanted to be able to continue to contribute to the community the way they did. It's important to get your orthopedic care at a dedicated orthopedic facility because everyone and all of the staff are here used to every single procedure. It's a routine for everyone, so you get the same faculty and the same assistants, and that facilitates you having a more efficient, faster surgery, and ultimately it's safer and better for the patients. So one of the best parts about being a physician over at OrthoUnited is this is a subspecialty group with multiple subspecialty orthopedic surgeons, and we consult with each other. So if I have a complex case about hip or knee surgeries, I can talk to 3 or 4 other hip and knee surgeons. Orthopedics is changing, and we're starting to see advertisements for new and upcoming different approaches in surgeries. So most of the surgeons here at OrthoUnited do muscle-sparing hip replacements, and some of us are switching over to muscle-sparing knee replacements as well. They overall facilitate faster recovery and less pain after surgery, and that further reduces your narcotic use and reduces your risk for complications after surgery. Most of the patients that I do surgery on now use less than 10 narcotic oxycodones after surgery. Historically, we used to say joint replacements would last around 15 years, but the most recent biomechanical studies that these joint replacements have 30+ year track history of surviving. So the worrisome thing about getting a joint replacement and then having to get it revised afterwards slowly fading away because of the advances in the way we process our implants. The most recent study in 2026 had a 92% survivorship at 30 years, and joint replacements put in 30 years ago. And I'll tell you, the implants we have now have a much better wear profile. Canton is very lucky to have such a concentrated area of surgeons that essentially perform a more complicated procedure to benefit their patients so they can recover faster. And not only do they do that, they do it at state-of-the-art facilities where entire teams of orthopedic staff can further facilitate and expedite care so patients' surgeries are done more efficiently. OrthoUnited is unique, and essentially it's a one-stop shop for all your orthopedic care. You can get injured and be seen the same day by an orthopedic surgeon. We have X-ray, MRI in-house, as well as a physical therapy team, and you can even get your surgery performed at the same location. So you become very familiar with the staff there, and everyone's on the same page, and your care is comprehensive by all team members. I've talked to all of our physical therapists about my protocols and how I want them to aid in my patient recoveries, and there's no question, if there's any complications that happen during physical therapy, they come over and talk to me personally, and I can come see you in the therapy office. Patients can be apprehensive about coming in to see an orthopedic surgeon, but surgery is not all we do, it's just something that we do. We provide complete care of joint pain in general. So just because you have arthritis in your knee doesn't necessarily you need surgery. In fact, surgery is our last resort. In general, we try to do everything we can to control your pain and improve your function. And ultimately, that's our goal together. All of my patients, they understand that together, our goal is to get them back to doing what they want to do in a pain-free or pain-tolerable manner, whether that be with something as simple as a medication with therapy, an injection, and we don't consider surgery until all of those things fail, until their painful joint is limiting their life and nothing else is helping them. And then that's when we start to consider a joint replacement. Something that's unique to my practice, I believe, is focusing on recovery. Historically, all of our conferences were focused on the 1 hour of surgery. And I think that we need to focus more on the perioperative period, and that includes both preoperatively and postoperatively. So now my job is to optimize patients the best they can before surgery. That includes nutrition and strength and ability to recover. So now all of my patients get a nutrition guide and a prehab protocol to help facilitate the recovery after surgery. One of the most satisfying things about my job is essentially giving the patients their life back. Patients have been dealing with a painful painful joint for years and years. They're putting it off because it hurts so much and they're nervous about surgery and the recovery. I've had patients come in around 2 or 6 weeks postoperatively, and they feel like they're 10 times better than they were preoperatively. A reason I went into orthopedics is so I could fix people, and then they don't have to see me all the time anymore. Medicine wasn't as interesting in that regard because I didn't want to have to keep bringing people back and give them medications all the time. We want to fix them and then see you later. Here at OrthoUnited, we're committed to providing the latest advancements in care to facilitate our patients' recovery and then returning them back to their life.